while the last few people are coming in, I'm going to get started and just ask that the people coming in do so quietly. It's just the noise is a little bit distracting, so thank you. So I today would really like to share some tips that I've learnt along the way from really fantastic educators in ACL Rehab, and I hope that this can be useful for your practice again when you go back to the clinics tomorrow. So there's going to be 4 key things that you'll be able to take to your clinical practice tomorrow. If I can make this work. Sorry about that. So there's sort of 3 sections of this talk and 3 things that I would like to cover with you today. The first is to look at planning rehabilitation and the things that we will focus on when we're planning our rehabilitation program with an athlete who has an ACL injury. And a lot of the research in this area focuses on athletes with ACL reconstruction, but I think the principles are the same if you are working with an athlete who's had surgery or an athlete who's chosen to have non-surgical treatment. Shared decision making is also going to be a key part of that, as we talked about yesterday. So I'll touch a little bit on shared decision making and how we can build that into our rehabilitation. And then the key part is these 4 key facts that we'll share. And the end goal after this session is that you'll have 4 key pieces of information that you can take with you to that decision-making table, that shared decision-making table, and feel confident to share that information with your athletes and with the other people that are involved in that decision-making process. I'd like to draw your attention to this really key resource. If you're working with athletes with an ACL injury, this is critical. So this is the latest evidence-based guidelines for rehabilitation in ACL that we have. And again, it's a free paper to download. So you'll need to type in evidence-based rehabilitation and BJSM into Google and it will come up. And you can download the PDF for free and stick it up in the clinic. Really, it's a really important resource. And the reason I draw your attention to this is because in 20 minutes, it's impossible to cover all of the important things in rehabilitation for ACL. As you know, it's really long, complex rehab. But this consensus, or this statement summarises all of the key parts of your rehabilitation program with the best quality research evidence that we have. So, the first thing I'd like to start with is a quiz, and this is not to make you feel silly, so please don't feel like this is a test and you're going to walk out the door and pass or fail. This is to get you thinking about important areas of rehabilitation. So I'd like everyone to get out their smartphone or their computer and go to this website. So I'm in Italy, so I'm using the best Italian resources for education. So Kahoot IT, grab your phones and navigate to this website. I'll give you a minute or so to find the website, and if you can switch to the other screen, please. So when you get to Kahoot.it, you'll see there's a little box to put in the number. And that will go to the right questions. So if you enter the number, and it will prompt you to put a username in. So you can make up whatever name you like. Is it working? No. Maybe if you can refresh the screen, please. Okay, let's see how this goes. So, it's working? Yeah. Kahoot IT, and then that number's the game pin that you put in. Ah, brilliant. Now it's starting to work. Super. Has anyone used Kahoot before? Put your hand up if you've used this before. Okay, a couple of people. Cool. Oh, this is excellent. Is there anyone else still waiting to get in? Put up your hand because we'll wait for you. We just need to know. Okay, yep. So while you're accessing the game, the way this will work is that there are 4 questions and you get 20 seconds to register your answer for each of the questions before it moves on. And the system awards points for the fastest and the correct answer. So the aim of this is to get the answer, the correct answer in the fastest possible time. And we've translated, so the questions are in Italian, the responses are in Italian, so hopefully that makes it a little bit easier for our Italian colleagues. Okay, is there anybody else who's wanting to get in? Yes? Okay. Can you, it's working or? It's not working, throw the phone. Okay. All right, I'm going to move on so that we don't miss out on the important stuff. So, first question's coming now. You've got 20 seconds. So our English-speaking colleagues, this is about open chain exercises and using them in rehabilitation. Okay, 5 seconds. All right, and there you go, there's the correct answer. Okay, so we've got quite a few people. Good stuff, Magnum, well done. Okay, ready for the next questions coming? So how long should you wait until you let the athlete go back to sport? Okay, so there we go, we're waiting 9 months, so okay. And good stuff. So we've got a new leader now, so Magnum's been pipped, you've got to get faster, Magnum. So next question. So how many people go back to sport? And this is the pre-injury sport, remember? Five more seconds. Okay, a lot of people, yeah, doing well. We've got another leader. Okay, so this last question is going to be our decider for the winner. So what's the re-injury risk here? Five more seconds. Okay, and a lot of people, well done. Well done to the 58 of you. And well done to Ed. Where's Ed? Oh, well done, Ed. Good job. Everyone give Ed a round of applause. Okay, and you can switch back to the main screen now. Thank you. So, thank you all very much. I hope that was a nice kind of interactive way to get into some of this content. And the idea behind going through those questions is that, as I said at the beginning, these are the 4 key areas that I'll cover in this session, and I think they're 4 key pieces of information that will help you planning your rehabilitation. And so when we are supporting athletes through this process of rehabilitation, there are two things that we need to figure out early on. And we talked yesterday about building confidence and trust. And in doing that, it's this discussion about figuring out what is the most important thing for that athlete, what matters to the athlete that you're working with. And those values, those things that matter, will then help inform the preferences that the athlete will have for treatment. And you can work with those things. So this is about setting up those realistic expectations that's critical for rehabilitation. And the aim is, as we talked about yesterday, to establish realistic goals. And that's why it's so important that you understand and that you know those statistics about returning to sport rates and re-injury rates. And you saw this continuum yesterday. So if we think about rehabilitation or as return to play as being a continuum, then we have our rehabilitation fitting into that first part, the participation part. But we've always got in the back of our mind that return to play is being planned along the way. So I'm focusing here on the athlete who has the goal to return to sport. And as we heard yesterday, the return to sport, if we think about it in this continuum approach, the return to sport starts from the time you first see that injured athlete. So we're always working towards that end goal. And the other thing that we need to keep in mind, and again we touched on this yesterday, is that who actually takes responsibility for the decision. And in ACL reconstruction or ACL injury, the return to play decision really should be something that the athlete takes responsibility for. And we saw that from the mental side of things, that's really important for an athlete to feel in control of that decision. And so we need to discuss this within our shared decision-making team as well. And as we talked about, and as you all know, the shared decision-making is about sharing information. And that's what we're doing today. We're sharing this information with our team so that ultimately the athlete is the one making the informed choice. The really important thing about shared decision making is that it works. We have very good evidence from healthcare. So shared decision making has been done for a long time in medical treatment, in decision making about medications and about surgeries, and we know that it works. So it helps athletes to improve their knowledge and their confidence in the decision and their understanding of why different decisions have been made. And when we do these things, then we get athletes who are more engaged in the whole process, and again that helps us build that confidence and trust. So this shared approach is really important for building the trust relationship with athletes, and we know how important that relationship is. So this is the ideal scenario for shared decision making, where we have typically the athlete, the clinician and the coach involved, but it doesn't always look like that. So shared decision making can also look like this, and this would be an example of concussion. So in concussion, the clinician is making the return to play decision because the athlete and the coach are not the right people to make that decision. They can still be involved in the process and in sharing the information, but the ultimate decision rests with the clinician. So let's move now to our 4 rehabilitation essentials. So this is the background information to those 4 questions that you just went through on the phone. The first key thing is quadricep strength. So quadricep strength, we know, has a really strong relationship to outcomes after ACL injury. So we need to have a big focus on quadricep strength in our rehabilitation programs. And I asked the question at the beginning about open chain exercises because open chain exercises can give us really a good exercise to use in early rehabilitation as long as we do it properly. And there was, for a while, a myth, and I think that myth is still out there, that open chain exercises destroy the graft, that you can't do them because they're a dangerous exercise. And that's not true, as long as you respect when to do the exercise, when to introduce it, and to respect the range of motion that you're doing that exercise through. So open chain exercises are safe to do after an ACL reconstruction, after 4 weeks, and through that limited knee flexion range of motion. And so then the question is, what exercise should I choose? And there's a whole bunch of quadriceps exercises out there. And I went to one of the world experts in ACL rehab, Hege Grindum, who is a physiotherapist from Norway. And I asked her, world expert, what exercises do you do with your patients? What do you think are the best exercises? And these are the 3 that Hege uses and thinks are really good ones. So the leg extension machine, and again, so that's one of our open chain exercises. Then she will move to the Bulgarian split squats, so the exercise in the middle, those split squats where you can add hand weights, you can add a barbell across the shoulders. And then the third exercise that Hege really likes is the box jumps. So, world expert in ACL rehab, these are her 3 favourite exercises for that early phase of rehabilitation. And then, once we've progressed beyond the early phase, so the first few months of rehabilitation, then we start to work more on agility type of exercises, build towards sport-specific tasks. So it's really important to know the sport well, engaged with the coaches. Build in direction changes, and Nikki talked about this yesterday. These need to be working towards exercises where there is an unanticipated part to that exercise. And control of landing. And these are all things that Hege Grindum is doing with her athletes with ACL injuries. The second key point, our second essential thing in rehabilitation, is to have good criteria for discharge. So these are the return to sport tests. And we know that there are some very simple tests that we can do that will substantially reduce the risk of a new ACL injury. And you saw these yesterday. So we need to respect the graft healing, and a lot of you already know this. You said that the 9-month point is the critical time point. So well done. The quadricep strength, the agility test. We need to have an athlete that is symmetrical in both the strength and the hopping performance, and they must have completed a sport-specific rehabilitation program. So very simple tests. They don't need a lot of equipment, and we can do these in the clinic. You can do these in the clinic tomorrow. Our third key point is understanding the return to sport rates. So we need to be able to give accurate information to these athletes. And you know, because a lot of you answered about 60%. So if we look at the return to the pre-injury sport, 2 out of every 3 of our athletes, and these are athletes of all levels, recreational right up to elite level, 2 out of every 3 of them go back to their previous sport. But only about half of them go back to the competitive sport. So key numbers to give athletes. And after a revision surgery, so again, this is really important because we will see athletes who have had an ACL reconstruction before, and the return to sport rate for these athletes is lower. So only 1 out of every 2 of them will go back to their pre-injury sport. For those working with professional athletes, the return to sport rates are higher, but still not at 100%. So 4 out of every 5 of our professional athletes across all elite sport will go back. And it's even higher again in professional football. So these professional football players, they go back after their ACL reconstructions, but quite a few of them don't continue to play for very much longer. So it seems like their career is shortened by the ACL injury. It may not be because their knee function is no good, but it might be that they lose a place in the team. So there's a lot of reasons why these people stop playing sport. You saw this yesterday, so I think these are things that you're really aware of, and it's important to be aware of this because you can start to think about and get clues about returning to sport as soon as a patient walks through your door. And you saw the psychological factors as well, and how important they are, and how they have such a big effect on the return to sport after injury, and particularly after ACL reconstruction. So we're keeping those in our mind, and you've got some good tools for how you can measure the psychological aspect. Our final essential piece of information for our shared decision making in rehabilitation is to understand the risk for re-injury, because this is vital for sharing with our athletes. And if we think about the risk for a second ACL injury after a reconstruction, then we are really especially concerned about our young athletes who are going back to a pivoting sport, so football, handball, basketball. So if you are just under 25, you have a 20% risk, or 20% of athletes under 25 will have a new ACL injury. If we just look at returning to those pivoting sports, again, 20% of those athletes who go back to a pivoting sport will get another ACL injury. And if we put both of those factors together, so the young age and the high-risk sport, the pivoting sport, then about 1 in every 4 of our athletes with an ACL injury will go on and have another ACL injury. So pretty high numbers. And as you know, injury prevention programs are incredibly effective at reducing injuries. So making an injury prevention program part of your ACL rehabilitation is absolutely vital for managing this risk. So to sum up, there's really 4 key components in ACL rehab, and this is particularly for an athlete who's having an ACL reconstruction. But if we have an athlete who's chosen not to have surgery, we're going through the same process. The prehabilitation just becomes part of our initial rehabilitation phase. So we're going to do a really good prehabilitation program. We focus on impairments, so building quadricep strength, improving range of motion and reducing swelling in the early part of rehab. Then we're building on that to sport-specific tasks. And finally, our return to play and putting in good decision-making criteria for return to play. And if we can do this, then we're working within this evidence-based framework. So evidence-based practice does not mean blindly following a research article. Evidence-based practice means that you consider the athlete's preferences, so that's why it's really important to involve the athlete in this decision making. You use your very high quality clinical reasoning and clinical knowledge, and you also use the research evidence. So it does not mean ignoring any one of those three circles. And good return to play decisions fit in the middle of that circle. So, really important point. We don't ignore research evidence, we don't ignore our clinical evidence or our clinical knowledge, and we certainly don't ignore the athlete. We consider all three of these things together. So, to sum everything up, return to play starts from when we first see that injured athlete, not at the end of rehabilitation. We have a really good understanding that not all of our athletes go back to sport after their ACL injury, and there's a whole lot of reasons why. We have some very simple tests that we can do in the clinic tomorrow morning that will reduce the re-injury risk very substantially. And we really need to work in this shared decision-making approach with our best quality research evidence, our best quality clinical practice evidence, and our athlete preferences, and that will give us quality rehabilitation and quality successful return to play. Thank you very much.
Thank you.